Shaken baby syndrome is a preventable tragedy. It is a severe form of physical child abuse, resulting from violently shaking an infant by the shoulders, arms, or legs. Shaken baby syndrome is the result of violent shaking that leads to a brain injury, which is much like an adult may sustain in repeated car crashes. It is child abuse, not play. Greatest risk are babies, newborn to 1 year, especially babies ages 2 to 4 months, but shaken baby syndrome can happen up to 5 years. Internal bleeding in the head is the main cause of death in case of shaken baby syndrome. Everyone, from caregivers to bystanders, should be informed how dangerous is shaking baby and what consequences it has. Shaking most often occurs in response to a baby crying, or other factors, that can lead the person caring for a baby to become frustrated or angry. All babies cry and it's normal part of development. And all baby do things that can frustrate caregivers. However, not all caregivers are prepared to care for a baby. There are no obvious external physical signs, such as bruising or bleeding, to indicate an injury. Severe case of shaken baby syndrome is death. In less severe cases, child can exhibit change in sleeping pattern or inability to be awakened, vomiting, convulsions or seizures, irritability, uncontrollable crying, inability to be consoled, inability to nurse or eat. Shaken baby syndrome can potentially result in the following consequences: death, blindness, mental retardation or developmental delays, or other form of serious disabilities. Prognosis is depend on injury severity and early medical intervention is important. Recommendations: babies can cry a lot in the first few months of life and this can be frustrating. But it will get better. Remember, you are not a bad parent or caregiver if your baby continues to cry after you have done all you can to calm him or her. You can try to calm your crying baby by rubbing his or her back, gently rocking, offering a pacifier, singing or talking, taking a walk using a stroller or a drive with the baby in a properly secured car seat. You can try to calm your crying baby by rubbing his or her back, gently rocking, offering a pacifier, singing or talking, taking a walk using a stroller or a drive with the baby in a properly secured car seat. If you find yourself pushed to the limit by a crying baby, you may need to focus on calming yourself. Put your baby in a crib on his or her back, make sure she is safe, and then walk away for a bit and call a friend, relative, neighbor, or parent helpline for support. Check on him or her every 5 to 10 minutes.